A lot of my patients come from a fair distance. I would say half the patients I see in a day come from more than 2 hours away. So that's a group that really it would make sense for telemedicine. Flip side, a little bit in Kentucky, not everyone's so literate with that as you described previously, right? So there were definitely people that struggled with the technology. But even for the people that didn't, I was surprised how many, even though we offered them continued telemedicine, as soon as they weren't sort of panicked about the pandemic, they really wanted to come in and see the doctor. So we're still doing telemedicine, but not nearly as much as I sort of anticipated it would persist. The other thing was, I saw a number of people in second opinions who had surgery recommended to them by telemedicine. And I didn't really agree with the recommendation. The recommendation fit the x-rays, but it didn't really fit the patient's exam. And, I wonder with telemedicine, whether it's not easier for the doctor to sort of put into the patient's mouth what they expect the exam to be, as opposed to you do the exam yourself. So I think I think telemedicine has tremendous value. But it's going to take us some time to learn what components of that we can inherently trust, what components, patients really understand what you're asking them. It's not the same as when you physically examine them. I would be hesitant to schedule a surgical procedure at this point, not having put my hands on the patient. For follow-up visits, especially patients far away, I think it's going to have, consistent use.